Did you know that the earliest signs of dementia can start showing up a full year before most people even realize something is wrong? They're not always the signs you expect, like forgetting names or getting lost. In fact, the earliest clues are often subtle, inconsistent, and easy to brush off. But spotting them early can make all the difference. In this video, we'll explore 5 early signs that older adults may show about a year before a dementia diagnosis and why families often miss them. Whether you're here out of concern for a parent, a spouse, or even yourself, understanding these early shifts can help you act sooner, plan smarter, and support your loved one with more compassion. Stay with me until the end, because this isn't just a list of symptoms. I'll explain what each sign really means, what's happening in the brain, and how to respond gently and effectively if you start seeing them. These signs don't guarantee dementia, but they do mean it's time to pay closer attention. And if you've ever had that gut feeling that something just feels off in someone you love, this may help you finally connect the dots. Sign number 1. Memory slips in everyday routines. We all forget things sometimes, but when someone begins routinely forgetting steps in familiar routines, like double paying bills, leaving appliances on, or repeatedly asking the same question, it could signal deeper changes in the brain. What makes this so easy to miss is how ordinary it seems at first. These moments aren't always dramatic, but when they start forming a pattern, especially in someone who was previously organized or detail-oriented, it's worth noticing. These lapses often trace back to changes in the hippocampus, the part of the brain responsible for forming and retrieving recent memories. And because most memory tests happen in calm, controlled settings, they might not pick up what's really happening in daily life. So, if you start seeing repetitive forgetfulness in day-to-day tasks, don't just chalk it up to normal aging. Look for patterns. Those patterns are often where early dementia begins to whisper. Sign number 2, trouble finding words or finishing thoughts. This one can be surprisingly subtle. Someone might speak more slowly, struggle to name everyday objects, or use vague words like thing or that place more often. You might notice longer pauses or sentences that trail off without a clear ending. At first, it might seem like a temporary distraction or low energy, but when it starts happening more regularly, especially during conversations that used to be effortless, it could reflect early changes in the brain's language centers. And here's something important. When people start struggling to communicate, they often withdraw. They may avoid conversations, skip social events, or stop sharing stories like they used to, not because they've lost interest, but because they're afraid of messing up. Watch how they speak, not just what they say. It can be one of the earliest windows into how their brain is processing the world. Sign number 3, disorientation with time or familiar places. This isn't always someone getting completely lost. Sometimes it's thinking it's morning when it's already afternoon, showing up for appointments that happened yesterday, or struggling with directions to places they've been going for years. Even more unsettling, they might feel confused in their own home, like forgetting how to get back inside after stepping out to the mailbox. This disorientation is often tied to early changes in the brain's ability to organize time, place, and sequence. The internal calendar we all rely on without thinking begins to slip, and that can make even simple tasks feel unfamiliar and disorienting. If you notice someone mixing up days, getting confused in routine settings, or seeming uncertain about familiar places, take note. These may be quiet signs that their brain's sense of orientation is shifting. Sign number 4, pulling away from social activities or hobbies. When someone starts quietly stepping back from activities they once loved, group events, phone calls, hobbies that require focus, it may be more than just low energy or mood. Often it's because they know something feels different. They might not be able to follow conversations as well. They might feel overwhelmed or afraid they'll forget something important. So rather than risk embarrassment, they retreat. This kind of withdrawal is one of the clearest early behavioral changes linked to dementia, and it often shows up well before a diagnosis. If someone you care about starts avoiding things they once looked forward to, especially social or creative outlets, it's worth paying attention. They may not be losing interest. They may just be losing confidence. Sign number 5. Subtle changes in judgment or decision-making. We're not talking about one-off mistakes here. We're talking about small but unusual choices that feel out of character, like giving money to a stranger at the door, wearing winter clothes in warm weather, or oversharing private details with strangers. What's happening is a breakdown in the brain's frontal lobes, which help us weigh risks, evaluate decisions, and exercise social judgment. And when that internal red flag system weakens, people may start making choices that don't reflect their usual reasoning. The hardest part? These changes can come and go. One day they seem totally fine. The next, something feels off. When you start seeing a pattern of unusual decisions, especially in someone who used to be cautious or consistent, it may be time to look beneath the surface, not with judgment, but with empathy. Final thoughts. These 5 signs, memory lapses, word-finding struggles, disorientation, withdrawal, and changes in judgment, rarely show up all at once. They appear gradually, quietly, often disguised as normal aging or just having an off day. But if you start seeing them repeatedly, that's your cue to pay closer attention. Dementia often begins in whispers, not shouts, and recognizing those whispers early gives you time. Time to adjust, time to support, and time to connect with the person you love while they're still themselves in so many ways. You don't need to have all the answers. Just being present, patient, and open can make a real difference. Behind every missed word or forgotten task is a person doing their best and needing a little more grace than they did before.